My name is Lloyd Oates, and along with my colleague Nick Firth, we want to know how neighbourhood poverty affects health psychology treatment access and outcomes. Our study focused on poverty in neighbourhoods, and when we talk about poverty or poorer neighbourhoods, we're not only talking about money, we're also considering poverty in terms of things like living environment, education, crime, health and employment relative to other people in the country, which is also known as deprivation. We know that people who live in poorer neighbourhoods are on average more likely to have mental health difficulties. They're also more likely to be referred for mental health treatment, but people in poorer neighbourhoods are less likely to actually start mental health treatment. So there's more need but less access, and this type of inequality is often called an access gap. There's also evidence that when people from poorer neighbourhoods access mental health treatment, that they're less likely to finish treatment, and they also have less improvement in their mental health symptoms on average, and this inequality is problematic. However, we didn't know whether these inequalities also affect people who have mental health problems because of a physical health condition. The aim of our study was to evaluate whether or not there was evidence of these inequalities in a specific health psychology service in England. And we used information collected as part of our everyday care in the service, which included information from 479 people who were referred to the service over the period of a year. And we had 3 questions. The first was, are there inequalities in how people from poorer neighbourhoods use the service? The second was, for people who complete treatment, does living in a poorer neighbourhood limit their symptom improvement? Finally, does the spread of people from different neighbourhoods who are referred to our service match what we might expect from the population? We found that when comparing people from poorer and less poor neighbourhoods, there was no difference in how likely someone was to attend assessment, to attend treatment, or to complete treatment. There was also no difference in symptom improvement. We also looked at the number of referrals to our service for people from different neighbourhoods compared with the numbers that we'd expect based on estimates of the population. We found that there were more people from poorer neighbourhoods referred than we might have expected, and there were fewer referrals from people from less poor neighbourhoods than we might have expected. So our findings suggest that there is no noticeable inequality in this specific health psychology service at this time. So that's great news. People in poorer neighbourhoods were just as likely to use the service and to benefit from the service. Our findings also suggested, though, that there was a greater health psychology need for people in poorer neighbourhoods. It's troubling that there's an increased need, but we found no evidence of an access gap, which is good to know. But this study was only able to estimate or guess at the amount of need in the community. We need to do more evaluation to have more confidence that we're providing an equal opportunity or an equitable service. Although these results are positive, this is just one study focused on one service. We need to continue to research these issues. Are health psychology services more equitable than mental health services? Or does it depend more on the service itself? We also can't assume that this service will always be equitable, so we need to keep checking. It's really important. And this study was helpful because it was completed with very little resources, and it just shows that services can, and that they should, be checking for evidence of inequality. If their results suggest that there might be an inequality, they need to take action to improve the situation. We need to keep thinking about what we can do to help make sure that people from all backgrounds can benefit equally from mental health treatment. Thank you.